Hi class, welcome again to another session on rehabilitation engineering. Today we shall discuss the medical team, the members of the medical team in brief, and the physiatrist and the physiotherapist in detail. So in the previous lecture, we had discussed the rehabilitation team, which consists of the medical team and the socio-occupational team. So this is actually an expansion of the medical team. The physiatrist is the lead for a rehabilitation medical team, and he or she are supported by the orthotist, the rehabilitation nurse, the physiotherapist, the occupational therapist, the vocational counselor, the clinical psychologist, the special educator, the social worker, and so on. So let us have a detailed look on the job of a physiatrist. So, physiatrists or a person who is specializing in physical medicine and rehabilitation is the leader of a rehabilitation team. They play the most critical role in the rehabilitation of an injured or a handicapped person. So their functions or their role involves clinical assessment of the patient, functional diagnosis of the patient, and then planning the treatment protocol for a particular individual. Now, the treatment protocol is very customized or very specialized for that individual. A treatment protocol that works brilliantly for me might not work for someone else. So that's why a physiatrist actually does personal evaluation of the patient and then customizes the treatment program according to the individual's requirement. These people are qualified in evaluating the disability, and then they know exactly what physiotherapy should be prescribed for a particular patient, the occupational therapy that needs to be prescribed that needs to be performed on the particular individual, and the orthosis or prosthesis that would actually aid in improving the functionality of that particular individual. They know everything. So they provide guidance to the patient and their relatives regarding the treatment protocol and the management of the condition. Because having an injury and becoming disabled is quite traumatic, not only for the individual but for the family themselves. So they need someone to, actually provide them proper guidance, someone they can confide to, someone who clear all their doubts and, help them cope with the situation better. And that is the job of a physiatrist. These physiatrists, they have sufficient knowledge in each and every medical, paramedical, socio-occasional specialties related to rehabilitation. They are supposed to know everything, and they are the friend, philosopher, and guide to a patient and the team. And they are expected to be empathetic, compassionate, and understanding, not only towards the patient but towards the team, because the team itself is dealing with a lot of stress in coping up with a particular patient. So they sometimes need someone to look up to, someone to seek advice from, and that is offered by a physiatrist. So they should bring up a physiatrist should understand the psychology of the team very well, and play according to the strength of the team and bring the best out of them and provide the best possible therapy to the patient. So they are the most important person in a rehabilitation team. So next is the physiotherapist. So the physical therapist or physiotherapist assists the patient in movement restoration. So disability leads to restriction in movement. So the job of a physiotherapist is to ease this restriction as much as possible. So they perform a thorough muscle strength evaluation and quantification, spasticity assessment, and measurement of joint strain. So they have outcome measures to evaluate the strength of the muscle. MRC scale is one such example. Then they assess the spasticity, the tightness of the muscle, and then they assess the range of movement in a joint, and then see whether any therapeutic exercise or any treatment procedure can improve this range of movement and allow the person to use a more functional movement. So on the therapy side, they perform or assist in performing exercises to maintain the range of thought. Either they sit and instruct the patient to move their arm, or they help the patient to move their joints so that the muscles start to work again, and then slowly but surely the spasticity reduces, and then the person actually ends up using performing more functional tasks. So sitting training, then stance, walking, increase in muscle strength, coordination of specified muscle or entire body are all part of exercise, part of goals that a physiotherapist have while dealing with a disabled person. So they often use heat or cold therapy or hydrotherapy, that is a swimming pool, where they allow the patient to use the pool and perform certain exercises. Dance therapy or Zumba for handicapped people are some examples. Underwater Zumba training and all. So these are some exercises which are not only enjoyable but have really therapeutic effect on the person. So I hope some of you remember physiotherapy devices from a BMI lecture. So in your own time, I would want you to want you to revisit the biomedical instrumentation book, and then find out the devices that are used for physiotherapy sessions, so that you can connect with whatever I'm trying. So patients often who are confined to bed are visited by a physiotherapist at their home to aid and evaluate the environment of the house and to provide a barrier free and accessible environment to the patient. So the use of various mobility aids, including wheelchair and its maintenance, are taught to the patient during these sessions. And for an immobile person, a physiotherapist gives progressive gait training with or without ambulatory aid, which means they give training for an immobile patient to sit up, stand, and start walking with or without ambulatory aid. That depends on the patient's condition and their level of disability. I think that's all we have time for this session. I said I shall see you again in the next session. Thank you very much.